wants many affairs and has great desire for sex, but she is also superficial, but she's got great orgasms because she she has this tension, great tension, which is really relieved when in sexual act. She can be giving, she can be also emotionally engaged in her affairs, but she is also very physical one concerning sex, yet at times superficial. Arsenicum. Arsenicum is very selfish, and self-centered. So he is a dictator in family and in affairs, a dictator. He's got misery. He knows all things and wants things all things to be done his own way. He is very suppressive, strict, suppressive, without emotions. Anagardium, no emotions, very logical, thinks he is the smartest, ironic. Other chronic constitutions. Well, that's about it. Pulsadilla. Pulsadilla is psoric psychotic. So she is very idealistic, giving, emotional, romantic. So she is a very good mother, although a very not so strict, a very good mother, a very good giving mother, a very good wife, giving, emotional, romantic, and so on. And at sex, she wants sex with romance, like phosphor. Thuja and Gelsemium have problems with relations, no self-confidence. So how can you have a good relation? No self-confidence, very shy, very problematic in its relations. Gelsemium is very timid, so he also have problems with his relations. They are both psoric and may be manipulated, become victims of syphilitic people. You can analyze in the same way any kind of field concerning psychology, profession, social things, political ideas of the person, any field having to do with the person or their behavior. I have talked with details in these fields because I wanted to show you that if you know the essence and the miasmatic aspect of the person, then you can do the following. The patient comes to you, the individual comes to you, and you may not ask anything, but he starts talking about his ideas, what happened to him, his relations, the family conditions, how he reacted to a certain thing, and so on. Then you've got all the information you want. You can take a case history, not only from a patient or an individual that comes to your office as a patient, but from your father, mother, children, friends, everybody, just by knowing how he reacts. How he reacts, behaves, thinks, feels, tell you his story, tell you his constitutional characteristics, his miasmatic characteristics. That's what our classical constitutional miasmatic method is about. He tells us how to interpret a person, how to get from what he says and does, and from how he looks from non-verbal information, to get clues, to get characteristics of the person. So you see, we encourage the person to talk and to act, to behave, and he talks to us by his whole existence, even by not talking, by just sitting, if he sits like that, or if he sits like that, how he talks, and so on. All things talk to us, only if as homeopathic doctors we know, we have in our mind the picture of the person, of the constitutions, the pictures of the constitutions. If we grasp the meaning, the central idea, the essence of constitutions, if we are well acquainted with constitutions, then we can interpret what the patient says or gives us with non-verbal information. So we need no repertory. We can just have it as a reminder. We need no repertory. We need no Ramaderia Medica to open and see at that time if we have the pictures in our mind. If we have got well acquainted with the pictures, and that's what I am trying to do with these lectures, with these lessons, when I describe to you these chronic constitutions. And you can read the whole detailed picture in the classical miasmatic constitutional materia medica volumes. When we have finished taking the case, then we proceed to differential diagnosis. What are the differences between classical miasmatic constitutional differential diagnosis and the usual differential diagnosis that has to do with repertorizing or keynote prescribing or computer expert systems? There are quite many differences, and very important ones. They are the same differences that we have in diagnosis, the same differences we have in differential diagnosis. Classical miasmatic constitutional homeopathy deals with the individual. Other differential diagnoses deal with the patient. That is chronic illness, that is state of clinical health, That is, we deal with characteristics. Here we have acute mostly illness, diseases, symptoms. On classical miasmatic constitutional differential diagnosis, we focus on the whole picture. Always on the whole picture and always on the essence. Partial picture. We focus on miasms. We use miasms in diagnosis and in differential diagnosis. Miasmatic information is very critical in doing differential diagnosis. If you have a person that cries a lot, weeps a lot, it may be a pulsatilla, which is a psoric psychotic constitution, or it may be lachesis, which is a syphilitic one. They both cry a lot, pulsatilla and lachesis. They both say that they are sensitive and romantic most of the times. They both do it in front of others. But the pulsatilla has a primary behavior. Crying for pulsatilla is a primary behavior. She is not faking that she is crying. While in lachesis we've got many secondary behaviors, and we don't take in consideration that it may be a secondary behavior instead of a primary. We focus on primary behavior. Those who do repertorizing, keynote prescribing, and computer expert systems, they confuse most of the times a secondary behavior for a primary one. They see a person, a woman that cries a lot, says that she's very sensitive, says that she cares so much about her children, and they believe her. But she is a syphilitic lachesis constitution that pretends to be a very good sensitive mother. And so they give pulsatilla instead of lachesis, and they lose the case. We focus on primary behavior. We deal with secondary behaviors only in order to go to the primary behavior. And we use miasmatic help. Differential diagnosis of repertorizing depends very much on keynotes and on physical symptoms. We depend mostly on the psychological profile and on miasmatic tints, psychological, and the whole. We deal here with chronic constitutions. We deal with acute and chronic. We don't deal with so-called homeopathic remedies that are not homeopathic. That is, with remedies that are rare and that are only proving pictures that don't have a corresponding natural picture of illness. So we don't consider them as homeopathic remedies. While a person who does repertorizing, keynote prescribing, and computer expert systems deals with 3,000 or 5,000 of so-called homeopathic remedies Well, most of them are not homeopathic remedies. They are but proving pictures that don't have a corresponding natural illness, that is, a corresponding constitutional picture, a corresponding constitution. So when we have come to take the case, and then we have to decide between, for example, pulsatilla, lachesis, sulfur, and so on. We'll always try to see, to differential diagnose according to the miasms, according to the essence, according to the psychological profile, and not according only if he is cold or hot. We do that also, it is helpful, but hierarchically it is not the decisive factors. The decisive factors are miasms, the whole picture, the psychological profile, and the essence. We may have less rubrics from pulsatilla and more rubrics from lachesis or from sulfur. But what counts is not the number of rubrics that we have, but the essence. And if we have less rubrics, but we have the essence of pulsatilla, we will give pulsatilla. We also try to choose chronic predispositions to prescribe, not acute ones. Polycrest, not rare. So we have finished the case, the diagnosis and differential diagnosis, and it's time to say some things to the patient. My tactic is to talk to the patient and give explanations 2 times. After I have taken the data of the patient, age, sex, and so on, and then the allopathic case, and before we go on general physical characteristics, and then on the psychological, and then on the differential diagnosis, at this time I give explanations, and at this time explanations. When I have done with the allopathic case, I try to explain to my patient that you have come to me with these with these diseases. If I am not sure about what he has, if he is not diagnosed, I must have a diagnosis an allopathic diagnosis of his diseases. And maybe I will tell him, you will do also these laboratory examinations in order to decide what kind of disease is that, this pain that you have, from what disease it comes from. So, after he gives me the diseases that he was diagnosed for, and after I am satisfied about what he has from the allopathic point of view, then before going to homeopathic case taking, I have to explain to him and answer to his questions. I must tell him what he has, how dangerous is what he has, what is the prediction, the allopathic prediction about what he has, and then I must tell him and explain to him what homeopathy can do about him, can do to him, and what we expect from my clinical experience to his case, and how homeopathy acts. What kind of medicines do we give? How homeopathy acts? In a few simple words, so as to have a clear picture in his mind of what we are going to do. You see, the informed patient is the good patient and the patient who will cooperate with the doctor, and we need that. And then, when we finish the case, and I have prescribed remedies for him, I have again to give him some explanations of what are the remedies I am giving to him, how will he receive them, what is the schedule, the plan of our treatment in general, and what he will do until the next consultation, what things to avoid, coffee and caffeine, and if he can, what will he do with the medicines that he is already taking, the allopathic remedies, if there is a need for any other remedy, chemical remedy, during the homeopathic treatment, what he will do, and so on. And then the consultation has ended. From my experience, an experienced homeopathic doctor that practices the classical miasmatic constitutional homeopathy, for a new case, needs about 45 to 60 minutes. A non-experienced doctor needs about 60 minutes to 75 minutes in order to take a first consultation and do it well. He needs about 15 minutes to write down the data and the allopathic, deal with the allopathic case, about 15 minutes for these explanations and these explanations, or 10 minutes, 10 to 15 minutes, and about 15 to 20 minutes for the main homeopathic case taking. This, if he is experienced. If he is not experienced, then he will do again 15 minutes for this and 15 minutes for this, for the explanations and the allopathic case, but he will need more for the homeopathic case taking. He may need from 40 to 60 minutes. The more experienced you are, the more to the point you are. There are cases, many cases, that the patient telephones to you and you are already quite sure what constitution he is, or to what 2 or 3 constitutions he is dealing with, he is influenced by, and how, if he is hypsoric, syphilitic or psychotic. But you never prescribe on hints. You prescribe on hints that are confirmed by your careful and meticulous case taking. And from my clinical experience, classical miasmatic constitutional homeopathy leads to great results. Great results. From my clinical experience, you can have a patient that does well, very well, at a percentage of 80 to 90 of the cases you have. They get very well. You cannot cure all of them. No therapeutic system is a panacea. But from my experience, classical miasmatic constitutional homeopathy has very good results and very deep and permanent results, because it aims at the chronic predispositions of the patient, from the chronic predispositions of the individual. I will say, what do I mean by does well, by cure? You see, so I have to compare three things, three methods. I have to compare the allopathic treatment, the mechanical methods, repertorizing in homeopathy, or keynote prescribing, or computer expert systems, with the classical miasmatic constitutional homeopathy. What does treatment mean? What does cure mean in these three methods? In allopathic medicine, cure means driving symptoms away or driving the disease away, or suppression of symptoms and disease. In repertorizing, keynote prescribing, and computer expert systems, we may cure, we may relieve symptoms if what we give relieve symptoms, or cure the acute illness. We mostly relieve symptoms if we are focused on symptoms. If I have fever and I always give belladonna, if I have fever and I give aconitumens or any other thing else, we relieve symptoms or we cure the acute illness. But we don't cure the chronic predispositions or the miasmatic influences or the deep chronic constitutional influences. In classical miasmatic homeopathy, constitutional homeopathy, we cure chronic illness we cure the individual. That is, we lessen his miasmatic influences and his constitutional influences. That is, we cure chronic predispositions. Here we have temporary results. Here we focus on acute symptoms or diseases. Here we focus on acute illness. Here we focus on chronic illness and on the individual. We focus on partial picture. We focus on partial picture. We focus on the whole. We focus on the patient. We focus on the patient. We focus on the individual as well as to his social relations, to his family and other relations. Cure here means this. Cure here means this, that his symptoms get better. Better symptoms. Sometimes better his psychological symptoms. Better physical symptoms. Sometimes also better psychological symptoms. And better his disease. But in classical miasmatic constitutional homeopathy, we say there are levels of cure. First of all, we have the criteria in order to decide that we have fully treated the patient and he gets well is first of all, we will see that his symptoms will be relieved. His physical symptoms of the acute illness, if he has one. Then we see that the diseases, not only the disease, the main disease, but all diseases, main and others, become well. Then we find that the general physical state of the patient gets better. Then that the general psychological state becomes improved. Then his chronic predisposition, gradually, if he has a treatment for some months or years, his chronic predispositions get well. Chronic predispositions. Then his miasmatic influences get less, and his constitutional influences are lessened. We cannot take them down to zero while a person is alive during this life. But we have less miasmatic and constitutional influences, and this makes him more healthy psychologically and physically, more free from these burdens, more natural. and we lessen the hereditary burden that he passes to his offsprings, to his children. This is what we mean when we say cure in classical miasmatic constitutional homeopathy. And that we do this because we focus on chronic illnesses, on the individual, not on the patient. We also treat his acute illnesses, but we always focus on treating his chronic predispositions, his miasmatic and constitutional burdens. And that's why we focus on constitutional remedies. Thank you.